Good evening, everybody, and welcome to another edition of the South Florida Tribune podcast. My name is Scott Morganroth. Glad to be joined by Gary Kornbluh. This broadcast here is presented by Senior Medical Associates, and I want to welcome Gary Kornbluh back to the broadcast. Gary, welcome back.
Thanks so much, Scott, for having me back. And let me just always start by thanking Senior Medical Associates. I know our viewers can't see the card I'm holding up, so I'll make sure and list the number. Senior Medical Associates is just a great senior care facility. Remember, senior care means 65 and older. So if you know anyone that fits that, they have about 10 offices in Broward County, which is South Florida, very close to Fort Lauderdale area. You can reach them at 954-659-9690. Once again, that's 954-659-9690. You can also log on to their website at seniormedicalassociates.net. Just a great group of people.
All right. So I just want to let everybody know that this broadcast can be seen on our YouTube channel, South Florida Tribune YouTube channel. You can also access it from www.southfloridatribune.com as well. So there are different ways to get it. And if you're looking to listen to the audio version, you can find it wherever you get your podcasts, South Florida Tribune podcasts. Some of the main ones out there include iHeartRadio, Spotify, Apple, Google, you name it. But those are the main providers that are out there. So feel free to look up South Florida Tribune podcast, and you can find it numerous places. If you're on your automobile, you can listen to it. If you're by your YouTube, then you'll find it on the YouTube channel. I encourage everybody that has an opportunity to tune in or listen in, grab a pen and paper, because I'll tell you one thing about our broadcast is they are very informative, and most people can't even listen to them one time. They'll listen to them multiple times because there's so much information to digest and comprehend. I love doing this with you, Gary, because our objective is to teach and educate and make sure that people make the best possible decisions. So with that said, Gary, what do you want to accomplish tonight?
Well, I want our viewers and our listeners to take away some really good information about Medicare. It's the annual enrollment, the annual election period that comes around once a year from October 15th to December 7th. It's fast approaching, and it's a confusing world out there. There's just, the airwaves are they just hammer the airwaves, these insurance companies, with every Medicare policy out there that's available. And it's it can be very confusing. And, so my job is to try to make insurance and Medicare and health insurance easy to understand for our viewers and listeners. So that's my objective, is just to help them to understand, and so that they can make the best choice.
Okay, well, let's go to it. Does Medicare come with dental and vision coverage? And if so, what is the cost?
Medicare, which is Part A and Part B, original Medicare. Of course, we know that Medicare Part A covers hospitalization, and Medicare Part B covers medical, doctor visits, specialist visits, and some other coverages. But basically, Medicare in general, Part A and Part B, do not come with dental or vision. In fact, if you have just original Medicare, you really need to purchase either a Medicare supplement policy to cover that gap, or a Medicare Advantage policy. If you enroll in a Medicare Advantage policy, then you will automatically, you'll have, let me just say, most plans come with dental and vision. And as far as the cost, there's really no cost at all inside that Medicare Advantage plan. They typically come with a zero plan premium. So once again, if you enroll in a Medicare Advantage plan, you would have the dental, the vision, the hearing coverage. If you're just opting to take original Medicare, and let's say a Medicare supplement plan to cover that gap, that 20% gap, that's a great choice. But again, just understand that it does not come with dental, vision, or hearing coverage. It's just the supplement is just designed to just cover the 20% that original Medicare does not cover. So the short answer is, does Medicare come with dental and vision? No. However, Medicare Advantage does, and there's no cost for that. It's included in the plan, and most plans have a zero plan premium.
Very good. Okay, so what type of dental and vision coverage can I expect from my Medicare Advantage plan?
Well, most Medicare Advantage plans do offer both preventative and comprehensive dental. Just be very careful, because there are some plans out there that only give you preventative dental, your exams, your x-rays and cleanings. And many plans don't give you those comprehensive dental services like, tooth extractions, fillings, bridges, crowns, root canals, that periodontal scaling. Most plans, I would say most plans do have the comprehensive as well as the preventative, but just be careful when you review them, or if you have an agent that you trust, just make sure that agent is aware that you want the full dental. You don't just want preventative dental. You want full preventative and comprehensive dental. As far as vision, let me just go back and just elaborate a little bit more about the dental. Usually, I mean, the typical amount of coverage in the Medicare Advantage plan in terms of the dental, it's not a huge benefit. It could be anywhere between, let's say, $750 and maybe $2,000 of annual coverage. The higher the dental benefit, usually the plans tend to take back on the other parts of the plan. Maybe they increase your co-payments a little bit, but again, we all know that there's no free lunch. If you're getting a much better benefit in one place in your Medicare Advantage plan, you can pretty much bet that they're taking away somewhere else. So but the dental it's pretty good. If you have a PPO Medicare Advantage plan versus an HMO, you're probably going to be a little bit better off because the network is a little bit bigger. Possibly your dentist will even accept that PPO plan. It's a little more difficult when you have an HMO. You tend to have to use kind of a general dentist. You typically don't have access to specialists like periodontists or orthodontists. So keep that in mind as well. But the dental that's available on that Medicare Advantage is typically full dental coverage. So it's decent coverage. As far as vision, usually the plans do have vision coverage, and they usually it's a zero copayment to the doctor, so there's no copayment to see the eye doctor. And then most plans actually give you a nice little stipend. Usually it's anywhere between, let's say, $150 and let's say $250 per year, and they'll give you that amount to apply toward lenses, frames, or contacts. So again, most plans do give you a little bit of help on that vision coverage. Most major vision most major vision centers actually do accept the Medicare Advantage plans as well. Without mentioning any names, I would venture to say that most of the big vision companies will take your Medicare Advantage plan. But like anything else, if you have a Medicare Advantage plan and like any of the other coverages on your Medicare Advantage plan, you always want to check to make sure that your vision plan, your vision company of choice is going to accept your plan. So just make sure that if you want to use, Lens Crafters, or you want to use America's Best, or whoever it is, just make sure they accept your plan. And there's typically, again, no cost for the dental and vision inside that Medicare Advantage plan.
Okay, very good. Does a Medicare supplement policy offer dental and vision coverage?
Okay, so if you opt for Medicare, if you opt to just have original Medicare, your Part A and Part B, um, and a supplement plan to supplement the A and B, keep in mind that supplements don't offer dental or vision. Okay, so if you go that route, most agents' opinion is that going with original Medicare and a supplement is your best choice for obvious reasons. You've got access to the entire Medicare system nationwide. But having said that, if you are interested in dental or vision, you will have to purchase those policies separately and pay a separate premium, separate and apart from your Medicare supplement premium. So in short, dental and vision coverage is not available with a Medicare supplement plan. You would have to purchase those in addition to the supplement.
Okay. Do Medicare Advantage plans offer coverage for dental implants? I know a lot of folks out there would definitely want to know.
Yes, yeah, they sure do. I get that question often. So yeah, so there are a select few carriers that actually do cover dental implants, but I'm not terribly thrilled about those plans, because here's what they tend to do. If they're, implants are very expensive, as everybody knows, and the coverages on these Medicare Advantage plans with respect to dental implants is quite limited. Some plans will only give you, maybe 1 or 2 dental implants, and it's usually let's say every 5 years. So that seems to be typical. So even though some plans do offer a coverage for implants, remember, if they're giving you a great benefit in one part of the policy, remember what I said? They're usually going to take away on the other parts of your policy. So what I usually see is that these carriers that offer coverage for dental implants tend to raise the copayment on the other services to make up for the dental implant coverage. So it can be good for certain people, but I would say by and large, I would say that, and I don't mean to discredit any companies, but I tend to stay away from those plans that offer coverage for dental implants, because I know they take or raise the copays on the other parts of the policy. So there's kind of a give and take there. I would rather show my client the more robust benefits when it comes to the medical, because as we know, the medical part of your coverage is so much more critical than the dental or the vision or the hearing.
Okay. All right. What are the typical co-payments for dental and vision coverage?
Co-payments for co-payments for dental and vision. So usually most plans offer 0 co-payments for those dental co-payments. So let's say you need, a filling or a tooth extraction. Usually those are 0 co-payments. As long as you're going to a participating dentist, usually there's 0 co-payments. There's also usually 0 co-payments for some of the other major services. Typically, basic services usually include fillings, tooth extractions, whereas major services usually are the crowns, the root canals, the bridges, the deep cleaning, that periodontal scaling, what they call it. But it's kind of nice, because they typically don't charge co-payments for any of those services. So if you have dental coverage as part of your Medicare Advantage plan, I think you'll be pleasantly surprised to know that the co-payments are very low, and in most cases they're 0 for those different procedures, both basic and major.
Okay. Is there a maximum benefit if I use my dental plan?
Is there a maximum benefit? There usually is. And I think I mentioned this earlier in the broadcast, but it's usually anywhere between $750. I've seen as low as $750, and I've seen as high as there are plans out there that have $2 and $3, let's say $3,000 of annual benefit on the dental side. But again, you may be paying up for that for your doctor copays, your specialists. You may have a higher copayment for an inpatient hospital visit or an outpatient visit. So again, I always say there's no free lunch, right? But usually, just to answer your question, the maximum benefit, if you use your dental plan, is typically anywhere between $750 and let's say about $2,000. And that's annually.
Okay. So what is covered under the vision benefit on a Medicare Advantage plan?
What's covered is naturally your initial visit with the eye doctor, and that's typically at a zero copay. Your glasses and lenses and contacts are also, let's say they're subsidized because the plan actually gives you a little bit of money toward those expenses. But usually, I mean, the vision coverage is fairly attractive. I mean, glasses and lenses and contacts can be, they can be a little bit costly, right? So to get a $200 or $250 benefit is really toward your contacts or your glasses is kind of a nice benefit. So again, typically zero for the doctor visits, and usually you'll get a little bit of a stipend toward those lenses and frames. Other than that, I mean, there's really not much involved in the vision coverage. That's pretty much it. Keep in mind that things like cataract surgery, things like cataracts and conditions of the eye, in many cases, especially in the case of cataract surgery, that's actually covered under under the medical portion of your plan. So just keep that in mind, folks, that's not covered under the vision benefit. Vision benefits cover you for glasses, so these surgeries, whether it's cataract surgery or any kind of, say, a surgery that's medically necessary, are typically covered under the medical portion of the policy, subject to either an inpatient copayment if you're going to be an inpatient, but usually you're going to pay an outpatient copayment because they're typically done on the outpatient level. Cataract surgery is really quite common surgery these days, and usually people are in and out the same day. But I guess the point I wanted to make is just understand that that's not part of the vision. The vision specifically covers your eyewear, your glasses, your contacts.
Well, amazingly enough, you talk about cataract surgery. I did have cataract surgery, and what you said is definitely validated. All right, let's move on to what is covered under the hearing benefit of a Medicare Advantage plan.
The hearing benefit, yeah, the hearing benefits are pretty good too. So there's zero copay to the hearing doctor. Usually when you purchase the hearing aids, usually it's a zero copay for the fitting, for the hearing doctor to fit you with those hearing aids to make sure they fit properly and they're working properly. And then most Medicare Advantage plans will actually give you a nice little amount, a nice little stipend toward those hearing aids. So some plans will require you to pay a copayment, and usually it's the hearing aids. Let's say they're standard hearing aids, and let's say you want the premium hearing aids. So naturally, the standard hearing aids may be, let's say, a $300 copayment, and maybe if you want the premium hearing aids, maybe it's more like a $600 copayment. So some carriers do that. Other carriers will just give you flat out that amount of money that you can apply, that stipend that you can apply toward your hearing aids. And those can vary anywhere between, the average that I've seen is about $600 per year, typically every 2 years. So that's a decent amount of money. Usually people like to get the premium hearing aids because they just work better. And with that, if you had a $1,200, a monetary benefit, that's going to cover the lion's share of the cost of that premium hearing aid. So those hearing benefits can be quite attractive. But that's pretty much it. The vision and the hearing are pretty much, they're very basic benefits, but they are good though. Let me say that they're good benefits. They're definitely a good ancillary benefit to have in addition to your medical coverage.
Well, amazingly enough, the one thing that's really good about what we're talking about, folks, is don't underestimate the significance of dental, vision, and hearing, because those are some of the main senses that we have. So, and I'm glad we were able to address those tonight. So with that said, Gary, why don't you give a summary of what people should try to get out of this show?
The summary and the takeaway, I would say, would be just understand the plan that you have. Make sure you're working with a knowledgeable Medicare agent, and just make sure that make sure that your agent is recommending a plan that's suitable. And suitability has many different levels. I mean, suitable in that you want to make sure that your doctors are accepting that plan. Suitable in that you want to make sure maybe your specialists are take that plan. Maybe it's more suitable for you to have a PPO and have exposure to a national network. Maybe that's not important. Maybe an HMO is more attractive, because even though you don't have exposure to a national network, the costs, the out-of-pocket costs, are typically lower on the HMO. And even with an HMO, you do have coverage typically for urgent care and emergency care worldwide. So even if you select an HMO, and God forbid you're in California, have an emergency, you'll still be covered. But the takeaway really, I would say, is that, it's really a daunting task trying to sift through all these Medicare Advantage plans. There's just a ton of them out there. And they just hammer us, every year, around this time. They just hammer the airwaves. And it can be really confusing. So my best advice is just, if you have a Medicare agent that specializes in Medicare, great. If you don't, find one. And don't talk to your auto and your homeowner's agent, because those guys, they're professionals with auto and homeowners insurance, not Medicare. But make sure you speak to an agent that's very well versed in both health insurance and Medicare. And that's basically what I've been doing for the past 32 years. And, I pride myself on the fact that I give people, just really, really good advice. And, if you go onto my website, and I'll give you that in a little bit, you'll see I've earned about 71 5-star reviews. That's because I've given my people good, solid guidance. And that's what I ask you to do from me. That's what I ask you to charge your agent with. Make sure that they recommend a plan that's suitable for you, because you may be stuck with it for a full year. Now, let me just say this. If you do, that's only partially true. If you do select a plan during the annual election period, which, remember, is October 15th to December 7th, and let's say you are unhappy with that choice, you always have the OEP, or the open enrollment period, which actually used to be called the Medicare Advantage disenrollment period, but it's now called just the open enrollment period, or OEP. That starts on January 1st and ends on March 31st. And so you can change that plan if you feel that you selected the wrong Medicare Advantage plan during the annual election. You can always make that change during the first 3 months of the following year. So it's not like you're locked in. But now, if March 31st comes, and you haven't made a change, then you're definitely in that plan until that next annual election period. You're actually in that plan until the following January. Because remember, the annual election period is just that. It's a period of time when you can elect or enroll in your new plan of choice. But always remember, that plan doesn't start until January 1st of the following year. So I guess in short, the takeaway is that just make sure you're working with somebody that is really well versed in Medicare. Make sure that's all they do. If they do, you can't really, in this business, you can't be a jack of all trades. You really have to specialize. There's really a ton of moving parts when it comes to Medicare. You want somebody that specializes in Medicare.
All right, just so you know, folks, South Florida Tribune podcast is presented by Senior Medical Associates. My name is Scott Morganroth, along with Gary Kornbluh. If you want to find this broadcast, you can go to our website, www.southfloridatribune.com. You can also find it on our YouTube channel, South Florida Tribune. There's no cost to subscribe to the South Florida Tribune YouTube channel, so I encourage you to do exactly that. You can find us broadcast to the audio way as well by going to iHeartRadio, Apple Podcasts, Google, Spotify, or wherever you get your podcasts. Well, let me tell you, listening to it is just as good as watching it. And I encourage you to take a lot of notes. If you want to find us on Twitter, you can do so at Tribune South. So Gary Kornbluh, why don't you go ahead and give your information before we call it a night?
Okay, so I'd be happy to help anyone that calls me. I've been known to help people, around the country. And even though, my business is here in Florida, I'll take any call from anyone and help anyone. I'm happy to give guidance, whether you're my client or not. I mean, that's just the way I operate. So feel free to call me with any question. Best number to reach me on is actually my cell phone, 561-305-5949. You can even text me on that number. Once again, it's 561-305-5949. And then you can always log on to my website, and that is www.medigapx.com. That's MEDIGAPX.com. Click on my testimonials tab up on the top right-hand corner, and you'll see what my absolutely wonderful clients have said about me. Only 71 of them, though.
Well, let me tell you another thing, folks. If you're watching this on YouTube, feel free to go ahead and comment on there. We make sure that Gary gets all the comments, and we'll get to those. And you can also email us at southfloridatribune@gmail.com as well. So those are the primary ways that you can get a hold of us, lots of different ways. So once again, feel free to go ahead and comment for you YouTube subscribers out there, or anybody that is watching it on YouTube. We do get to every one of your questions and so forth. And once again, the email address for us, southfloridatribune@gmail.com. You can go ahead and contact me, Scott, or send them to Gary as well if you don't get through to him, and we'll make sure we get all your questions answered. So nice job tonight, Gary, as always. Once again, I do want to point out the South Florida Tribune podcast tonight is presented by Senior Medical Associates. My name is Scott Morganroth, your host, along with my co-host, Gary Kornbluh. We do this. I want to make sure that everybody is on the right track when it comes to every piece of information that we can provide you, and hope that you get as much out of it, these shows, as much as we enjoy bringing you the material. So on behalf of Gary Kornbluh, my name is Scott Morganroth. Thank you for joining us on this edition of the South Florida Tribune podcast. And until the next time, folks, please be safe out there, follow the science, and don't take COVID-19 lightly. It is a very, very dangerous situation, and we hope that you guys are very safe and blessed. So take care, everybody, and we will catch you on the next episode of the South Florida Tribune podcast. Good night, everybody.
Good night, everyone.